what's working, what's not working in your rural area. The committee members all know this, but for our panelists to understand, our charge from Speaker Scott is to come up with a set of recommendations where we can that are actionable for the General Assembly, be that through legislation or even a budget amendment. And I know all of you who joined us today are frontline providers, and so you've got a unique perspective, and we'd really like to hear that. So what I'd like to do is keep your sort of overview to like 5 minutes, but then we've got a not a shy group here, and so I think you'll have questions from the group, and we'll look forward to that dialogue. So with that, if I go to the agenda here, I've got starting with our dentist, I've got Roger Palmer listed. And Dr. Palmer, are you on? Let me jumping back and forth here on my screen. Yes, right there. So Roger, you want to kick us off?
Sure. I didn't know exactly what you wanted and talk about 5 minutes. It's difficult for me. I could probably talk for 5 hours, but 5 minutes may be difficult. But anyway, my name is Roger Palmer. I practice in Emporia, Virginia. I for the last it'd be 48 years tomorrow, I believe, since the first day I started practice. I'm the chairman of the Virginia Dental Association Council on Government Affairs. I'm also a member of the Dental Advisory Committee for DMAS, Medicaid. As a Navy brat, never had more than 2 consecutive years in the same school system, moved all over the world. But I graduated from First Colonial High School in Virginia Beach, commuted to Old Dominion, and went to MCV VCU and graduated in 1976. I started practice in Emporia with the intention of returning to Virginia Beach after a year. I married a girl from this area. Anyway, I was doing well in Emporia. 1 year turned to 5, and now it's 48. So I enjoy the people. I see 4 generations of many families. My wife taught 3rd grade when we moved to Emporia, and some of those are grandparents now. So the population is static in a rural area a lot of times. So you see multiple generations, unlike where I grew up in Virginia Beach. During the school year, half the kids have moved in and moved out. So practicing in a rural environment, you have to learn to manage problems that normally, if the specialist right down the street, you send them to a specialist. But when a kid comes in, they've got a front tooth knocked out playing softball or basketball, you're the expert all of a sudden. You have to learn how to handle things like that, because our nearest specialist can be an hour away sometimes. A lot of times when a patient has severe swelling or something like that, we end up having to take care of it and drain an abscess ourselves. Whereas, if you go to practice in a large town or something, you've got a specialist, 2 doors down. The ability to do so much is really gratifying. It gives you a very open practice where you get to see all kinds of things rather than sitting there just doing fillings every day. Greensville County is one of the poorest counties in Virginia, and a significant people either have Medicaid or then they don't have any dental insurance at all. So it's a problem there. And I've been seeing Medicaid patients. We call it insurance in our office, not Medicaid. We never say Medicaid, for 48 years. And the children are wonderful, and I've got many of them have grown up, and it's nice to see that they've got good teeth, because that really helps in a job environment. If you apply for a job and your teeth are in really bad shape, it's difficult to get a job. One of the problems we have in a small town is we don't have specialists. So if somebody really needs to see a specialist, it's difficult to refer them because they don't have transportation and things like that. I'm speaking mainly for like Medicaid, because we see a lot of Medicaid patients. The next problem we have is workforce, especially since COVID. We lost a significant number of our dental hygienists. A lot of them just retired. They didn't want to take the risk of being in somebody's face, take a chance of getting COVID. So we need to increase the number of dental hygienists in our workforce. And currently we have a problem with the Commission on Dental Accreditation requires that there be 1 instructor for every 5 students. And you can build more hygiene schools, but we think that the answer to, when I say we, it's the Virginia Dental Association, we think that the answer to this is to change it so that an instructor could supervise 10 students. And then you could double the output of the schools. But right now, that's a thing that's really causing a problem with them not being able to get enough dental hygienists. Because in small towns, people really have a hard time getting and keeping hygienists. Now, there's four of us in Emporia, and what we've always done is just hired high school students to work in our offices and bring them along. And, then they're interested in dentistry and they can get an education. In fact, my associate graduated from dental school in 2018, but she started when she was 15 in my office. So another problem we have is to get young dentists to come into an area like Emporia. We're lucky. Everybody in Emporia is a local dentist except me, and I married a girl from Emporia. But these kids are graduating with so much student loan debt that they're having to work for big corporations and stuff like that. And if they work for a government clinic, they can get loan forgiveness. And we think that if a student goes to work in a private practice and they see a significant amount of Medicaid patients, that they should be eligible for that too. The last thing I'd like to address is the dental school. We need a new dental school building. It was the General Assembly allocated $5.2 million for that, for study to get that going this year. And we desperately need it so we can attract the best professors and also the best students. In conclusion, we have an lack of access to dental service in rural areas. And one thing I didn't really touch on is Medicaid transportation. The Medicaid patients have transportation through a Medicaid cab and whatnot, but we have a real problem with the cab bringing them in to their appointment at the appropriate time. In other words, like patient has an appointment at 10 o'clock and they will show up at 11, because the cab brought them. So anyway, that was what I had to say. I'll be happy to answer any questions if anyone has any.
Dr. Palmer, thank you so much for that background. And just a quick comment, several things you mentioned, I think were on our radar, since your last comment on transportation. That's a common theme we have heard, but I appreciate your perspective too on the hygienist ratio. That's certainly something we can look at. Let's go to Delegate Waxman's got a question.
Yes, I do. Thank you for attending, Dr. Palmer. I enjoy seeing you on the my phone here. You mentioned that you've been in practice, I think, 48 years. Since you have quite a bit of experience, I was wondering if you could maybe comment on what it's like to be an independent practitioner in a rural area. Has it gotten easier through time? Has it gotten more difficult through time? And if you can, other than the cost, identify any type of barriers that may make it more difficult for somebody to come into a rural area to practice?
I think now with the amount of debt that the young people have is a problem, because when I went into private practice, it was not unusual for somebody to buy their equipment, build a building, and set up, shop. And I think that'd be virtually impossible now. Like I said, I have a young associate who came in with me, and she's going to take over. I'm working 3 days a week. But as far as the things that got easier later, I think you ask the physicians who are here, everybody will tell you, it's gotten a lot harder to practice than it was 48 years ago. There's all kinds of roadblocks put up.
I think you're fortunate you've got somebody to transition in. You mentioned that there were, 5 dentists in Emporia, so I expect it's the two of you in your practice and 3 more. Could you speak about maybe the age of the other 3, and if you're aware of, do they have any type of plan on getting somebody else to transition to their practice?
They are both young. They both have large offices, and I'm sure they're planning on bringing in associates with them. But I think Dr. Swenson I believe he's 50, and Dr. Harmon, she's in her late 30s, I believe. So that's sometime on the horizon. Right now, most dentists are practicing until they're about 70. It used to be, people thought about retiring at 65, but I thoroughly enjoy it. So I look forward to going to work every day, enjoy the people.
I think I see a question. Oh, yeah.
Thank you.
Yeah.
Oh, sure thing.
Delegate Srinivasan.
Thank you, Chairman. Dr. Palmer, thank you for your testimony and thank you for what you're doing for Medicaid. My question is on the dental hygiene program. You had a great point about the ratio, but let's say we are able to change the ratio. What is your assessment of the interest in the community for students to come in, and how much does it cost for a student to go through a dental hygiene program? And is that a career path that you think that there are enough demand in rural areas? Thank you.
I saw a thing the other day that the average dental hygienist is somewhere around $50,000 in debt after hygiene school, whereas, and I believe they were talking about a bachelor's degree there, not a 2-year program. But yeah, I mean, it's really a good profession. But like I say, one of the situations we have is a lot of hygienists don't practice that long. They don't have really long careers. Now, personally, I'm lucky. My hygienist has been with me like 28 years, and I have an assistant who's been with me like 33. But I think there's plenty of interest in young people wanting to be hygienists because it pays well and it's actually it's a pretty good job. Did I answer that for you?
Yes, sir. Thank you. Can I ask a follow-up, Chairman?
Absolutely.
But when you say, Dr. Palmer, folks are interested, 50,000 is for probably a 4-year. Is 4-year a requirement, or can I be part of a practice with a 2-year, and then I can get my, remaining 2 years later, and I can have a good career?
Yes, they have a number of community colleges that have 2-year programs. We have one in Roanoke Rapids, which is right down the road from us. And but Old Dominion and at VCU is a 4-year program. Well, you have to have 2 years of prerequisites, and then you do a 2-year hygiene program. But when you finish, you have a bachelor's. You can't teach dental hygiene unless you have a bachelor's. I personally think the education is better at Old Dominion and at VCU, but that's my own opinion because I've worked with hygienists from both places.
Thank you. I'm a ODU alum. Thank you so much.
Your Monarchs. Any other questions for Dr. Palmer? We can certainly come back to you because we do have one other dentist to speak, and we may have some questions we'll get joint answers on. We've got Dr. Laura Settles, and Laura, why don't you go ahead and start, and if we end up with questions for both of you and Dr. Palmer, we can come back that way, but let's go ahead and have you jump in.
Great. Thank you for having me. It's interesting that I get to follow up right after Dr. Palmer. My name is Laura Settles. I'm practicing in Wythe and Bland counties in Southwest Virginia. And I'm just 4 years out from dental school. Earlier this week was my 4-year workiversary. So I'm still pretty new at this, but I've got great mentorship, and I wrote down a few things that I wanted to make sure that I brought to everyone's attention. So if that's all right, I'd like to go ahead and read that.
Yeah, please.
A person's health is the foundation to their success, and a person's oral health is imperative to their overall health and confidence. The health issues that impact particularly rural Southwest Virginians include obesity, diabetes, and heart disease, which was covered earlier in the conversation. Rural Appalachians also have to overcome stereotypes and stigma associated with tooth decay and edentalism. One program that I'm involved with here is the AEGD, which is an advanced education in general dentistry through Appalachian Highlands Community Dental Center in Abingdon, which is in Washington County. The largest dental Medicaid practice in Southwest Virginia, I think past Roanoke. And of the 22 graduates that have come through the program, 6 of those have chose to stay in rural sites in Virginia after graduation. So this program creates dentists with expanded competencies that train firsthand in delivering care to rural communities, and they're choosing to stay in the area. These programs meet the needs of people who were previously waiting for those one-time annual pop-up clinics, and now they get to come to a comfortable office setting and get a full range of dental care as opposed to what can be delivered in those remote settings. I'd also like to stress the challenges of referring patients for specialist care. It's common for patients who need root canal treatment to have to wait several weeks or months in pain with active dental infections in order to get an appointment. And the same problem is seen with oral surgeons and pediatric dentists. Just last week, I had a 5-year-old male in the office, and I saw an area on his x-ray that appeared to have the potential to be a cancerous lesion. And I spent most of my morning, Thursday morning, calling offices to try to find someone who would see him for a biopsy and treatment. I called over 10 providers and could not find an office within 90 miles that would see my patient. And several families that I have are unable to see specialists due to the expense and the lack of reliable transportation. The existing programs for Medicaid patients to schedule transportation to appointments in this area require about 2 weeks' notice, and practitioners lose countless hours of chair time due to the high no-show rate. This is one of the reasons that providers tell me that they're choosing not to participate in Medicaid. So some kind of short notice transportation system, like a Medicaid Uber type program to help fill in those short notice openings could be really beneficial. I also have a tremendous amount of student loan debt. I always planned on coming back to rural Southwest Virginia. This is my home. My patients are my neighbors, my friends, my family. I always knew I would come back here, and I've been fortunate to find a nonprofit organization to work for, so I'll qualify for public service loan forgiveness. But I know a lot of my classmates who would have otherwise come to rural areas chose to work for larger corporations or to work in areas with a bigger population just so they can see more patients. So I really appreciate your time. Thank you for letting me speak, and I'll be happy to give you my perspective for what my 4 years have been like here in rural Southwest Virginia.
Excellent, Dr. Settles. Thank you so much. And I'll just start with a comment that I'm so glad you came back. That's a challenge we see in these rural areas is it's hard to get people who come who are not from the area. We could put incentives out there for doctors, nurses, dentists, et cetera. But what we've seen so far is that you get past that initial incentive period and then folks go back to where they came from. So I appreciate you coming back to your roots there. That's excellent. I'm going to go to Delegate Srinivasan's got a question for you.
Thank you, Chairman.
Sure.
Dr. Laura, thanks for your testimony. Can you say a little bit more about the program in Abington? I was trying to follow that. So is it a dental college or is it a new program? If you don't mind, and share some more details.
Sure. I'd love to talk about that more. So Appalachian Highlands Community Dental Center is a residency program for 1 year after a dentist completes dental school to get more training and experience in advanced procedures like implant placement, molar root canal, things that normally are referred to specialists, and they get more comfortable with these procedures. One of the things that we've noticed with the graduates is that with our large faculty, we have students that come to the area, they're learning these advanced procedures, they're getting mentorship and establishing a relationship with doctors in our area, and then they're going to become associates with them or help them create an exit strategy for retirement. So it's been beneficial to the community and to the local dentist in the area who are on the faculty, maybe 1 or 2 days a month, but getting those relationships, it's been pretty cool to watch.
Mr. Chairman, can I ask a quick follow-up question?
Absolutely.
Dr. Laura, who runs this? Is this run by the community college, or is it a consortium? Who runs this program?
So the AEG director is Dr. Scott Miller. He's a prosthodontist, which is a specialist in tooth replacements.
Uh-huh.
And it's accredited. The name of the organization escapes me, but it's run through Ballad Hospital. Ballad Hospital works with us for that. Yes.
Got it. Okay, I can follow up and we can do some of this. Thank you. Thank you for sharing.
No problem. Thank you.
Thank you, Mr. Chair.
Yeah, that's all right. Dr. Settles, I think you said this at the beginning when you were talking about that same program there. But so you finish your regular dental training, you come there for this additional year of more specialized or training or more training in specialty techniques and procedures. Do you pay for that? Are you paying tuition for that, or are you providing services so that's part of the compensation or part of the financial model? I'm not sure how that works.
So the residents are paid through Ballad, through the hospital, and they see Medicaid patients, but they're not reimbursed on any kind of commission based.
Mm-hmm. So you're there as a resident. Yeah, that makes sense.
Mm-hmm.
Excellent. Any other questions for Dr. Settles? Okay, well, that was great. We appreciate the dental perspective.